Welcome to another in our video series on the topic of microsocial determinants of health. And I'm Doug Nussman, head of sales for Montoux here in North America. And with me today is Mike Hughes, subject matter expert. And in this session, we're going to talk about the economic impact of social determinants. So Mike, I guess I'll just ask you the question, when you're beginning to look at some of the economic impacts, how do we think about social determinants in money terms?
Yeah, so I look at it in terms of the risks associated with social determinants, how those risks contribute to the likelihood of falls, accidents, and poor health outcomes, and how this can lead to higher and often unnecessary spending by individuals, insurers, and health systems. So, I don't know, to offer an analogy, if somebody doesn't go to preventative primary care appointments, it's more likely that, I don't know, a cancer diagnosis would be made at the point where the disease is far more difficult and expensive to treat. By that same example, if someone doesn't tape down the edge of a rug that's been curling up, eventually they're going to trip on it. The same thing goes for incorrectly taking medications or not using assistive devices properly. The risk of falls and injury and expensive care goes up.
So, a lot of this seems to relate to function, your ability to get around, do things for yourself. Does that sound right?
Yeah, absolutely. And it's right there in the numbers. So according to the Commonwealth Fund, if you're a patient with 3 or more chronic conditions, and that's about a third of all patients in the US that are 18 or older, by the way, you'll cost the healthcare system about 50% more on average. But when you add just one functional limitation to this mix, trouble with walking or transfers and that sort of thing, the cost balloons to 330% more on average. Why? Because people trip and they fall and they go to the most expensive site of care, which is the ER in the hospital. And in fact, it's estimated that people with three or more chronic conditions and at least one functional limitation represent about 5% of total US patients, but they consume nearly 25% of all health spending. And this is one big reason why Medicare is at risk for insolvency, quite frankly, and why the clinical world is very interested in changing the way it looks at and cares for people who are age 65 and older.
Can you say a little bit more on that here?
Yeah, if you look at Medicare's annual budget, hospital and institutional care is the second highest piece of the pie. And that's behind their payments to Medicare Advantage plans, the plans that kind of administer the Medicare benefit on Medicare's behalf. Hospitalizations, it's about a quarter of all their spending. And a lot of this concentrates in those high need, high risk patient populations, like the people with multiple chronic conditions and the functional limitation. And so that's why they've been doing things like incentivizing and also penalizing health systems for hospital readmissions, reducing them, penalizing them if they're too high. Because, and most of the reasons why people readmit after they've been discharged are not because their clinical condition declines, it's because they trip and they fall and they get home, or they can't get their medications, or no one's at home to take care of them in the first place, all these social determinants. And it's also why Medicare or CMS has given new license to Medicare Advantage plans to integrate new types of benefits into their policies to address microsocial determinants of health. And now it started in 2019, and now you're seeing things like home care hours, exercise plans, meal delivery, transport assistance, even pest control being offered as a supplemental benefit. But really supporting day-to-day function is important. It's estimated that insufficient support for people with functional limitations costs Medicare about $4 billion annually. And it's frustrating because a lot of the things that can address risk are pretty common sense and affordable.
Thanks, Mike. We really appreciate you sharing these thoughts with us. And to continue the conversation, please feel free to reach out directly to me or Mike.